Diabetes can be managed in three ways. You have to talk about the medication that the diabetes patient needs. You talk about changes in diet that a person with diabetes needs to make. But another important aspect of managing diabetes is exercise. Exercise is a very important aspect of managing diabetes because it has numerous benefits for a person living with diabetes. Today, we'll start discussing about the various benefits of exercise and we'll continue the discussion in subsequent videos. So apart from helping to control the blood sugar, there are other aspects, there are other benefits that exercise gives that is extremely important. One, how does exercise help reduce the blood glucose level? We said the major problem that a person with diabetes have is he has elevated blood sugar level. So what exercise does is that it helps in the utilization of that glucose so that you will not have high blood sugar. The second thing that exercise does is that it improves the sensitivity of insulin. We said that people with type 2 diabetes have what we call insulin resistance. That means the body is not sensitive to insulin. While exercise does that job, it improves the sensitivity of insulin so that the little insulin you have can easily be utilized and ensure that that glucose in the blood gets into the cell. So apart from controlling the blood sugar, exercise also helps to lower the blood pressure. How does it do that? First of all, it improves the strength of the heart. So the heart becomes strong to perform its function. It also makes the blood vessels relax so that they will not resist the normal functioning of the heart. Apart from that, it also reduces the levels of adrenaline. We know that adrenaline makes the blood vessels to become narrow and that will elevate the blood pressure. So exercise lowers the level of adrenaline. So cumulatively, with a stronger heart, with the relaxed blood vessels, and with the reduced action of adrenaline, the blood pressure will lower. Exercise also improves the level of cholesterol. One of the challenges that people living with diabetes have is elevated levels of cholesterol. So how does exercise help diabetes patient with that? It increases the level of the good cholesterol. You will be aware that your doctors have told you that there are different types of cholesterol. We have the bad cholesterol, which is the LDL, and we have the good cholesterol, which is the HDL. So exercise improves the levels of the HDL. So the reason why we always say that the HDL is the good cholesterol is because it picks up cholesterol from the blood vessels and other aspects of the body. It takes it to the liver where it's broken down and excreted. So exercise improves the level of HDL, which is the good cholesterol, thereby protecting your heart and protecting your brain from stroke. Exercise has been found to improve sleep. You wonder, how is exercise related to sleep? The sleep hormone, the main hormone that regulates sleeping and waking, is melatonin. Studies have shown that exercise increases the level of melatonin. That's why it's sometimes advised that people that have difficulty sleeping should do light exercise in the evening. That will increase the level of melatonin and help them to sleep. Exercise has also been found to improve mood. If you're moody, you're having challenges with your mental health, exercise can help. How does it do that? Exercise increases the level of the feel-good chemical, and a particular chemical that works in the brain, which is nicknamed feel-good chemical, is endorphins. The endorphins are extremely important for you to have a stable mood. Exercise increases the release of these endorphins in the brain, thereby ensuring that your mood is always good. So you can see that exercise has numerous benefits apart from reducing the blood sugar level. However, you need to do this exercise the right way because if you do any exercise beyond the level that your body can handle, it becomes dangerous. So what are the dangers of doing excessive exercise? First of all, your blood glucose can be low because if you do excessive exercise, most of your blood glucose will be utilized and your sugar can go low. And when your blood sugar goes low, you become sweaty, your heart start beating, you're shaking all over, you're having dizziness, confusion. So it's important not to do excessive exercise. Apart from that, excessive exercise can lead to injuries to your knees, to your foot, and sometimes such injuries can lead to wound on the leg. And you will remember that we don't want any diabetes patient to develop any wound, because unless you have very good sugar level, that wound might not heal. It is important to know that diabetes patients that have problems with the eye, which has been detected by the ophthalmologist, that's the eye doctor, you should be careful with excessive exercise because that may lead to the blood vessels in the eye to bleed. And when they bleed, your eyesight, your vision may be impaired. So it's important to do exercise as recommended. So you can see it is extremely important that you follow the instructions of your doctor. Remember, before doing any exercise, you need the clearance of your doctor on the type of exercise and the duration that you need to do. Because though exercise reduces blood pressure, if you do it excessively, certain stress hormones like adrenaline and other like cortisol may be released. These stress hormones, instead of helping you reduce the blood pressure, it will elevate the blood pressure. So if you want to see the next video on the various exercise I recommend for a person living with diabetes, type in the comment section, write part 2. Can't wait for part 2. Write it that way. And I will make sure that I do a video on the various type of exercise that you need to do.